Today, I would be briefing you on everything about metabolic syndrome. What is metabolic syndrome? Metabolic syndrome is a silent pandemic which affects at least 25% of the population of the entire globe. It leads to various cardiovascular complications, neurological disorders, blindness, diabetes, etc. Metabolic syndrome is classically defined as a constellation of several related problems. Mainly, it's composed of 5 main things. First is the abdominal obesity, which we also call as truncal obesity or a large waistline. Second one is elevated blood sugar levels or insulin resistance. Third one is elevated triglyceride levels. Fourth is very low high density cholesterol levels, which are also known as good cholesterol. Fifth one is high BP or elevated blood pressure levels. So all these together leads to an increased risk of cardiovascular diseases such as heart attack, stroke, several liver disorders leading to liver failures, kidney failures, etc., and many other chronic conditions which will ultimately lead to a poor quality of life and leading to untimely or premature death. Now, what are the causes of metabolic syndrome? Mainly the causes are genetic factors, obesity, overweight, that is, sedentary lifestyle, lacking physical activities, improper dietary habits. These all can lead to metabolic syndrome. And also alcoholism and smoking on a chronic basis can add on to the risk factors. Coming on to the prevention. How do we prevent metabolic syndrome? So there are various methods. First and foremost, maintaining a proper diet, consuming a lot of fruits and vegetables in your diet, avoiding oily, fatty food items, avoiding junk foods, high-calorie diets needs to be controlled. Having regular physical activity on most days of the week also can help to prevent the syndrome. And lastly, quit smoking if you are a smoker. Now, coming on to the treatment aspects, which include majorly the diet, exercises, and the medications. A healthy diet can help you lower your weight. There are few diets which we recommend. First and foremost is the Mediterranean diet, which includes most of fruits and vegetables, whole grains, seeds, and nuts in your diet. This, to a certain extent, helps to reduce weight, lower your cholesterol, and keep you away from developing diabetes or hypertension. The second diet is the DASH diet, which stands for Dietary Approach to Stop Hypertension. This is basically a low salt, low fat diet, which helps to prevent hypertension and to keep your cholesterol under control. Third one is a high fiber diet. A high fiber diet is very important, as in at least a 30 gram per day of fiber in your diet to a certain extent can keep you away from developing hypertension and to reduce weight. Coming on to the exercise aspect, the recommendation is at least 40 to 45 minutes of moderate physical activity in a day on at least 5 days a week. If you're not able to exercise 40 minutes in a day, what you can do is divide your times, at least and try to do exercises 10 to 15 minutes, at least 3 to 4 times a day. Lastly, the medications. Take the medications advised by your doctor regularly. And last but not the least, remember to have regular follow-up with your physician, because this is very important to keep you at bay from the metabolic syndrome.